There is a sound that follows some people everywhere. Into the bedroom at night. Into the quiet of Sunday morning. Into the middle of a conversation, when everything else goes silent except for that high-pitched ring, or that low, steady hum that only you can hear. If that sounds familiar, I want you to stay with me for the next several minutes, because what I'm about to walk you through is not a miracle cure. It is not a secret the medical industry is hiding from you. It is simply a pattern that researchers and clinicians who specialize in auditory and nutritional health have been observing for years, and one that most people with tinnitus have never heard explained clearly. My name is Dr. Walter Strong. I have spent more than 2 decades working at the crossroads of nutritional medicine and neurological health. And the question I keep coming back to, the one that drives most of my work, is this. Why do so many people with tinnitus experience noticeable improvement when they address specific nutritional deficiencies, and why does no one tell them this is worth exploring? Today, I want to give you a real, honest, evidence-informed answer to that question. I will walk you through 5 specific nutrients that research suggests play a meaningful role in auditory nerve health. I will explain what happens inside your inner ear when these nutrients are low. I will tell you the foods that can help, the supplement forms that are actually absorbed, and the one sequencing mistake that causes most people to give up before the approach has a chance to work. But before we get there, I need to tell you something important. Tinnitus has many possible causes: circulatory, neurological, structural, medication-related, and others. Nutrition is one piece of a larger picture. What I'm sharing today is not a replacement for a proper medical evaluation. If you have not had your tinnitus assessed by a qualified physician or audiologist, that is your first step. Not supplements, not dietary changes, a proper evaluation. What I am offering here is a complement, a way to support your body's own systems while you work with your healthcare provider. With that said, let's begin. Let's start with what may be the most widely studied nutrient in relation to tinnitus: zinc. Inside your inner ear, there is a structure called the cochlea. It is a fluid-filled, spiral-shaped organ responsible for converting sound vibrations into electrical signals that your brain can interpret. The cochlea is fed by one of the smallest blood vessels in the human body, a structure so narrow that even subtle changes in local blood flow or oxidative stress can affect how well it functions. Zinc plays a critical role in protecting the hair cells within the cochlea. These are specialized sensory cells, and they do not regenerate the way other cells do. Once significantly damaged, they are gone. Zinc acts as one of the primary antioxidant defenders in this environment. It helps neutralize what are called free radicals, chemically unstable molecules that can damage cell membranes, disrupt electrical signaling, and contribute to the kind of oxidative stress that some researchers believe plays a role in phantom sound generation. When zinc levels fall below optimal, the hair cells become more vulnerable. Some research suggests they may begin producing erratic electrical signals, signals that the brain, doing its best to make sense of incoming information, can interpret as sound. A study published in the American Journal of Otolaryngology examined zinc levels in patients with tinnitus and found that a meaningful proportion had serum zinc levels significantly lower than control subjects. Other research has explored whether zinc supplementation leads to improvement in tinnitus severity, with mixed but promising results in certain subpopulations, particularly older adults. It is worth noting that zinc deficiency is genuinely common, especially in adults over 50. Routine blood panels do not always include zinc screening, so many people are unaware of their status. The best dietary sources of zinc include oysters, which are by far the most concentrated source, followed by grass-fed beef, pumpkin seeds, hemp seeds, and lentils. If you eat 2 tablespoons of raw pumpkin seeds daily, you are getting roughly a third of your recommended daily intake. That is an easy habit to build. Scatter them over a salad, stir them into oatmeal, or eat them as a snack. If you are exploring supplementation, the most bioavailable forms are zinc picolinate and zinc bisglycinate. A typical adult dose for general support ranges between 25 and 40 milligrams per day. This is a conversation to have with your physician, because excessive zinc over time can interfere with copper absorption, and that imbalance has its own consequences. One practical note: if you take a zinc supplement, take it in the evening with food, and separate it from your morning coffee by at least 90 minutes. I will explain why that matters in a moment. The second nutrient, and in many ways the one most directly connected to the electrical misfiring that produces tinnitus symptoms, is vitamin B12. Your auditory nerve, the nerve responsible for carrying sound information from your ear to your brain, is wrapped in a protective coating called the myelin sheath. Think of it as insulation around an electrical cable. When that insulation is intact, signals travel cleanly and efficiently. When it is compromised, the signal becomes noisy, irregular, and prone to the kind of spontaneous misfiring that the brain can register as phantom sound. B12 is essential for myelin production and maintenance. Without adequate B12, the myelin sheath gradually deteriorates. And here is what makes this particularly relevant to tinnitus. The threshold for nerve level adequacy is higher than the threshold used in standard blood tests. Many people with tinnitus have B12 levels that fall within the laboratory's reference range, meaning a doctor would look at the result and say everything appears normal. But the optimal range for myelin repair and neurological function is often cited by researchers as higher than the standard cutoff. This means some people are experiencing functional B12 insufficiency, while their lab results appear unremarkable. Research published in the Journal of Laryngology and Otology found that B12 supplementation in patients with noise-induced tinnitus led to measurable reductions in symptom severity over a period of several weeks to months. The effect was not universal, but it was significant enough to support further investigation. The most bioavailable form of B12 is methylcobalamin, not cyanocobalamin, which is the cheaper synthetic version found in most standard multivitamins. Methylcobalamin is the form your nervous system can use directly. If you are supplementing, a sublingual tablet, one that dissolves under the tongue, of 1,000 micrograms daily is a commonly recommended starting point for neurological support. Dietary sources include wild-caught salmon, sardines, beef liver, eggs, and dairy. If you eat these regularly and still suspect deficiency, the issue may be absorption rather than intake. Certain common medications significantly reduce the body's ability to absorb B12 from food, including metformin, which is widely prescribed for blood sugar management, and proton pump inhibitors, which are used for acid reflux. If you take either of these, ask your doctor whether your B12 levels have been checked recently, and whether they have been checked using a complete B12 panel, not just the standard serum measure. The third nutrient is one that most people associate with sleep and muscle cramps, but it has a surprisingly direct connection to auditory nerve function. Magnesium. Here is the mechanism. When the body experiences stress, and stress here means not just emotional stress, but also noise exposure, sleep disruption, illness, or inflammation, the brain releases a neurotransmitter called glutamate. Glutamate is the primary excitatory neurotransmitter in the nervous system. In appropriate amounts, it is essential. In excess, it overstimulates neurons and can contribute to a state sometimes called excitotoxicity, essentially nerve cells being driven too hard for too long. The auditory system is particularly sensitive to glutamate overload. When the neurons involved in hearing are chronically overstimulated, they can begin firing in the absence of actual sound input. Magnesium acts as a natural regulator of this process. It blocks a specific receptor called the NMDA receptor, which is the primary pathway through which glutamate overstimulation occurs. Without adequate magnesium, the auditory system has no effective brake on this process, Research from multiple institutions, including work done at the University of Michigan, has found that magnesium deficiency significantly amplifies hearing damage from noise exposure, and that supplementation reduced tinnitus-related symptoms in a meaningful percentage of study participants. A simple question worth reflecting on. Do you notice that your tinnitus is worse on days when you are more stressed, sleep-deprived, or run down? For many people, the answer is yes, and that pattern is one of the clearest indicators that the magnesium-glutamate pathway is worth addressing. Dietary sources of magnesium include dark leafy greens like spinach and Swiss chard, dark chocolate with at least 70% cacao, avocados, almonds, and black beans. A single cup of cooked spinach provides roughly 40% of your daily magnesium requirement. If you supplement, look for magnesium glycinate or magnesium threonate. The threonate form is notable because it has demonstrated the ability to cross the blood-brain barrier more effectively than other forms, meaning it can reach the central nervous system where the auditory processing happens. A standard dose is 300 to 400 milligrams in the evening. Evening timing matters because magnesium also significantly improves sleep quality. And sleep is when much of the nervous system's active repair and consolidation occurs. The fourth nutrient surprises most people, vitamin D3. Most of us think of vitamin D primarily in terms of bone health, but D3 functions more like a hormone than a simple vitamin. It activates receptors throughout the nervous system, including in the auditory pathway, and it regulates a range of genes involved in protecting cochlear hair cells from oxidative damage. A study published in the Annals of Otology, Rhinology, and Laryngology found that patients with chronic tinnitus had significantly lower vitamin D levels compared to matched control groups without tinnitus. In a follow-up intervention, supplementation led to meaningful improvement in symptom severity among participants who started with deficient or insufficient levels. The proposed mechanisms are twofold. First, D3 reduces systemic inflammation, which in turn supports better blood flow through the small vessels that supply the inner ear. Second, D3 appears to modulate calcium channels within the hair cells themselves, channels that, when dysregulated, may contribute to the spontaneous electrical activity associated with phantom sound perception. Achieving meaningful D3 levels through food alone is genuinely difficult. Fatty fish, egg yolks, and fortified foods provide some, but rarely enough. The majority of researchers working in this area recommend daily supplementation of 2,000 to 5,000 IU, taken with a fat-containing meal since D3 is fat-soluble. There is an important partnership to understand here. Vitamin D3 works most effectively when taken alongside vitamin K2. D3 increases calcium absorption. K2 directs where that calcium goes, steering it toward bones and away from soft tissues where it does not belong. Taking D3 without K2, particularly at higher doses over time, is not ideal. Look for a combined D3-K2 supplement, or take them together. Before supplementing at higher doses, it is worth having your D3 level tested. A simple blood test can tell you where you stand. Deficiency is far more common than most people expect. Some researchers estimate that more than half of adults over 60 are in the deficient or insufficient range. The fifth nutrient brings us to the cellular level. Omega-3 fatty acids, specifically DHA, docosahexaenoic acid. The membranes of your cochlear hair cells are composed largely of DHA. When your diet is chronically low in omega-3s, those membranes become less fluid, less flexible, and less responsive to the subtle mechanical vibrations that represent sound. This is a structural problem, not just a biochemical one. But there's a second mechanism even more directly relevant to tinnitus. Omega-3 fatty acids significantly reduce blood viscosity. They make the blood more fluid. And given how narrow the blood vessel feeding the cochlea is, even modest improvements in blood flow can meaningfully affect how well the hair cells are oxygenated. A meta-analysis examining 7 clinical trials found that regular omega-3 consumption was associated with a 31% reduction in age-related hearing decline in men over 50. While that finding relates to hearing loss rather than tinnitus specifically, the underlying circulatory and structural mechanisms are closely related. The most bioavailable sources of DHA and EPA, the 2 most clinically active omega-3 fatty acids, are wild-caught fatty fish, salmon, mackerel, sardines, and herring. 2 to 3 servings per week, prepared through baking or grilling rather than frying, is a reasonable dietary target. If you supplement, look for a product that specifies at least 1,000 milligrams of combined DHA and EPA per serving. Algae oil is worth considering as an alternative. It is the original source of DHA in the marine food chain, and it delivers the same compound without the fish. Take omega-3 supplements with food. Keep the bottle refrigerated after opening to prevent oxidation, and be consistent. These fatty acids accumulate in cell membranes gradually, so their effects build over weeks and months, not days. Before I give you the sequencing protocol, the piece that determines whether any of this actually works, I want to address 2 factors that can silently undermine everything else. The first is in most people's kitchens: caffeine and phytates. Caffeine increases the rate at which your kidneys excrete zinc. Research suggests that 2 to 3 cups of coffee per day can reduce net zinc absorption by as much as 30 to 40%. This does not mean you need to give up coffee. It means timing matters. Do not take your zinc supplement or eat your zinc-rich foods within 90 minutes of your morning coffee. Phytates are naturally occurring compounds found in many grains and cereals. They bind to zinc in the digestive tract and carry it out of the body before it can be absorbed. Many people who are consciously trying to eat well are simultaneously blocking absorption of one of the most critical minerals for their auditory health. If you eat oats regularly, soaking them overnight significantly reduces their phytate content. It takes about 30 seconds of planning and meaningfully improves the nutritional yield of your breakfast. The second factor is in some people's medicine cabinets. Certain medications are classified as ototoxic, meaning they can affect the functioning of the inner ear. Aspirin taken regularly at pain management doses, not occasionally but consistently over months and years, has been shown in research to reduce cochlear blood flow and contribute to outer hair cell stress. This effect is generally dose-dependent and in many cases reversible if caught early. But for someone taking aspirin or NSAIDs daily, it is a conversation worth having with their physician. Other potentially ototoxic medications include certain diuretics and specific classes of antibiotics. I want to be clear. This is not a reason to stop any prescribed medication without guidance. It is a reason to have one direct, specific question ready for your next appointment. Are any of the medications I am currently taking known to affect hearing or tinnitus? That question takes 10 seconds to ask. The answer could matter significantly. Now here is the piece that most people get wrong, and the reason many people try this approach and see no results. When you introduce multiple supplements simultaneously, several of them actively compete for the same absorption pathways. Zinc and copper compete. Iron and zinc compete. Calcium and magnesium compete. If you flood your system with all of them at once, you get a fraction of the benefit you would receive if you introduced them in a structured sequence. Here is the protocol that allows each nutrient to actually reach the tissues that need it. In the first 2 weeks, focus only on zinc and magnesium. Give your absorption pathways time to stabilize. Let your zinc levels begin to recover before you add anything that will compete with it. In weeks 3 and 4, add B12 and D3. By this point, your zinc levels are sufficient to support the enzymatic processes that make B12 conversion more efficient. D3, taken with a fat-containing meal alongside K2, can begin doing its work without interference. From week 5 onward, add omega-3. At this stage, your cell membranes are primed to integrate DHA effectively. Throughout all of this, maintain the 90-minute separation between zinc and caffeine, take magnesium in the evening, and take D3 and omega-3 with food. One more critical piece, the timeline. The auditory nerve does not regenerate quickly. The myelin sheath, once it begins rebuilding, does so over a period of weeks to months, not days. The cochlear environment shifts gradually, not overnight. Most research examining nutritional interventions for tinnitus notes that the first meaningful changes in symptom severity appear somewhere between weeks 3 and 8 of consistent implementation. That window, weeks 1 through 3, is where nearly everyone quits. Not because the approach is not working, but because the repair is happening at a level they cannot yet perceive. The silence comes after the repair, not during it. Staying consistent through that invisible phase is the single most important variable in whether this works. Before I close, I want to give you something concrete and immediately actionable. A single meal that delivers all 5 core nutrients in one sitting. I call it the recovery dinner, and it takes about 30 minutes to prepare. Start with a 150-gram portion of wild-caught salmon, baked, not fried. This one ingredient covers your omega-3 DHA and EPA, a significant portion of your vitamin D3, and a substantial amount of your daily B12. Serve the salmon over a generous bed of fresh spinach, dressed with olive oil and fresh lemon juice. The spinach delivers magnesium. The olive oil provides the dietary fat that D3 requires for absorption. The lemon supports iron absorption and adds brightness without adding anything harmful. Scatter 2 tablespoons of raw pumpkin seeds over the top. There is your zinc for the day. Finish with freshly grated ginger, not powdered, but fresh root grated over the dish. Ginger contains active compounds called gingerols and shogalls that have demonstrated microcirculatory support in research settings, meaning they may help with blood flow through small vessels, including the kind that supply the inner ear. One meal, 5 nutrients, 30 minutes, and it is genuinely good food, not a medicinal chore. Here is what I want you to take from today. First, if you have not had a thorough medical evaluation of your tinnitus, Schedule 1. Nutrition supports the body. It does not replace diagnosis. Second, at your next routine blood draw, ask your doctor to include B12 and vitamin D3. Understanding where you actually stand changes everything about how you approach this. Guessing is inefficient. Knowing is actionable. Third, start with zinc and magnesium this week. Not next Monday. Not when it is more convenient. This week. Begin building the foundation. The rest follows. Fourth, and this is important, do not expect to feel different in the first 2 weeks. That is not a sign it is not working. That is the nature of how slowly auditory tissue changes. The people who see real results are the ones who commit to the full protocol and do not abandon it in the early weeks when nothing seems to be happening. Tinnitus is not a simple condition, and there is no single answer that works for everyone. But the nutritional foundation I have described today is one of the most underexplored, most accessible, and most consistently supported areas of research in this field. It costs relatively little. It has limited downside when approached responsibly and in conversation with your physician. And for a meaningful number of people, it makes a real difference. You deserve to explore every reasonable option. I hope today was a step in that direction. Take care of your hearing. I will see you next time.